Half of us aren't doing the basics of exercise that experts say we need to stay fit and healthy. It seems to be a bigger problem in the countryside, if a new study undertaken in South Australia's Riverland region is any guide. Researchers say the situation is getting worse and they're calling for a shake-up in the way exercise and nutrition programs are delivered across the country. Celise Gibson has this report from Renmark.
New exercise guidelines released this month have doubled the amount of time it's recommended the average Australian should spend exercising, up to an hour 5 days a week. But according to researchers at the University of South Australia, 47% of South Australians don't even meet the old recommendation of 30 minutes 5 days a week. Suzanne Carroll is a researcher at UniSA.
Those sorts of numbers are actually right across Australia, that it is around about half of Australians that actually meet recommendations.
And she says the outlook is even worse in the regions.
The population health study found that levels of inactivity in the Riverland region went up to around 57%.
Is it a concern that levels are this high?
Absolutely. It is definitely a concern that levels are this high. We've been working for some time to try and change physical activity levels, and we're still struggling to have a great amount of impact in this regard.
Lincoln Size is the chief executive of the Country South SA Medicare Local, which coordinates primary healthcare services in South East and South Australia. He says the research isn't entirely surprising.
Rural residents face a number of barriers to exercise, including limited accessibility, availability of places to be physically active, extreme weather, traffic, fear of unattended dogs, all that sort of thing.
Mr Size says exercise and nutrition programs should be easier to access.
In terms of health outcomes, we know that chronic disease such as diabetes, cardiovascular disease, leading from obesity and various other lifestyle choices can be positively influenced through health promotion and health literacy. So from our point of view, increasing health literacy within the community so that people understand that the lifestyle choices they make do impact their health is a high priority of ours.
Suzanne Carroll agrees.
I think a lot of people actually know that they need to be more active than they are. So it's finding ways to break down some of the barriers that they have towards actually meeting the recommendations.
She says many people would benefit from gender-specific exercise programs.
Often the drivers for men and the drivers for women aren't necessarily the same, and this might be because of, it's for sociocultural reasons, in that women might be mothers and they might have certain roles that they're trying to fulfil, and that means that their demands on their time can be quite different to men at times, and because of the differences in these sorts of roles, it does mean that some of the barriers for women might be different to the barriers for men, and it's something that you just need to be aware of when we plan interventions.
In Renmark, 3 hours northeast of Adelaide on the River Murray, the local council is running a program to encourage people to lead healthier lifestyles. It's set up a community gym and arranges bushwalks and bike riding. Project Officer Stephanie Coughlin says it's local programs like this that change people's behaviour.
It's making them aware of alternatives and just to motivate them to get moving. I mean, a lot of our programs are get walking, get moving, get thinking.
And she says the results speak for themselves.
We have had feedback from a member of the community that he's halved his heart medication. We've also had a woman in her 70s who's lost 10 kilos, and she was told that she was bordering diabetes, and her doctor said, just keep on doing what you're doing and you'll be fine.
Stephanie Coughlin ending that report from Celise Gibson.